Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. As you know, this is a webinar where we're going to talk about Lyme disease. None of our webinars are the same because they're created by your questions. So I'm as usual, I'm very interested to see what you have in store for me tonight. For those of you that are returning, I see a lot of familiar names here. I'm glad to see you keep getting value and you keep coming back. And I hope you're getting some benefit out of it as well, too. For those of you that are new, there's a couple ways to participate. One is to hear the questions as I read them. And you also, if you're in the live version, you actually be able to see them on your screen too. And then see what responses I give. There's a lot of learning that can take place that way. The other way is to actually go bold and write a question to me. And the way you do that is on the computer, on the right-hand side of the screen, down at the bottom is a chat box, and you can write your question to me there. The only thing I ask about writing questions is that keep in mind every time you hit the enter key, it sends a separate question to me. So don't hit your enter key to create paragraphs. That won't work. Okay. So write your question as one long run-on. And for this format also does better with shorter questions. If the question gets too long and complicated, I may just not get to it at all. This format works better for shorter questions, okay? All right, so, and the other thing I just had an apple. I'm getting a little gassy there. Anyhow, as usual, I am creating a recording tonight. I will do some small edits on that tonight and then have it out for you tomorrow morning. I usually send that out with a brief summary about what we talked about too. And I should have that out to you tomorrow morning, somewhere between 9 to 9:30 in the morning, if everything goes as planned and if the recording works out. Rarely it doesn't, but usually it does. Okay. All right. And so I think I've covered all the background stuff we got to talk about here. I think we'll go ahead and get started and take our first question here. So let me see what we got here. Oh, one other thing. I do have another webinar scheduled for next week. And so tomorrow morning when I send that email to you, there will be a link that you can click to sign up for next week's webinar as well too. Okay. All right. All right. Let's go ahead and get started here. So hi, Craig. Let's see. I've had chronic Lyme for 10 years. How would you determine someone has chronic Babesia too? My blood tests are unremarkable except for some new autoimmune findings. Atypical ANA, elevated thyroid peroxidase antibody, and elevated free light chain ratio. I recently had an increase in fatigue, numbness, and tingling in the hands, headaches, dizziness, and drenching night sweats, so my LMD suggested treating for Babesia. However, since having an unprovoked pulmonary embolism, the night sweats went away. Should Babesia still be suspected? I don't think Babesia Immunobot was available 10 years ago. Is it worth doing? If so, is there any advantage to the additional PCR and FISH to complete the panel, which is cost prohibitive? Or is it just doing the Immunoblot? Okay. All right. So let me make a few comments here. I'll try to answer that. So yes, people can have chronic Babesia in addition to having chronic Borrelia Lyme infection, in addition to having chronic Bartonella infection, okay? The reason I didn't say Anaplasma and Ehrlichia, which are some of the other co-infections that people get, is generally those infections will respond pretty well to a 1 month or so of a tetracycline, like a doxycycline, tetracycline, minocycline. Those are all the tetracyclines, okay? But Babesia, Bartonella, and Lyme, unfortunately, for about 15% of people, they don't respond to those shorter courses of antibiotics, okay? All right. So, and then in terms of some things you said here, so you've got some autoimmune illness going on. That would be your anti-nuclear antibody, the ANA, is elevated at 640, okay? It should be probably 40 or less, to be honest with you. So that's elevated. The thyroid peroxidase antibody also means that your immune system is attacking your thyroid gland as well too, okay? So there is some autoimmune aspect to your illness. Now, it's possible that your autoimmune illness is triggered by your tick-borne infection. it's also possible you have autoimmune illness separate from your tick-borne infection. The one thing, though, I like to do whenever I have somebody that has obvious autoimmune component, either as a second illness or as part of tick-borne infections, is I like to have them take something called Lowdose Naltrexone. And so naltrexone is a narcotic blocker, and it blocks narcotic receptors. We have our own set of narcotic receptors. They're called endorphin receptors. Our bodies make something called endorphins. Endorphins are used by our bodies to regulate pain, but also to regulate the immune system. And if you use naltrexone at a low dose, the effect of that blocking your endorphin receptors will last maybe 4 to 6 hours. And during that time, the endorphin receptors become super sensitized to any endorphins that are around. And the brain doesn't like it. And the brain sends out all kinds of signals to the endorphin producing cells to make more endorphins. So at about 4 to 6 hours after the dose wears off, these endorphin receptors that are super sensitized get flooded with excess endorphins. And it can regulate an immune system that's attacking you, which is what autoimmune illness is. It can turn it down, okay? So one thing that, and I know you didn't ask, but I just want to let you know, when I see somebody with obvious autoimmune illness going on, whether it's Lyme caused or not caused, I find benefit usually using low-dose naltrexone. Starting dose is 1.5 milligrams a day. And over 4 weeks, you work up to 4.5 milligrams a day. It has to be made by a compounding pharmacist, and you need to give it at least 6 months to see if it's going to make a difference for you. At the end of our discussion here, or here in a minute, I'll show you the link to the article that I've written about low-dose naltrexone. Okay, all right. So then, in terms of could you have Babesia, so the main symptoms that make me think of chronic Babesia are night sweats, which you say got better after your pulmonary embolism, but night sweats, ongoing fatigue, frontal headaches, so headaches in the front of the head up in this area. Sometimes migraines can be part of it, feeling of air hunger, not being able to get enough air from time to time. And sometimes people with Babesia get a lot of little red broken blood vessels under the skin. So you have these little red petechiae kind of looking lesions as well too. All right. Now, the fact that your night sweats went away could suggest that maybe you don't have Babesia. But if you are still having headaches and you have a lot of ongoing fatigue that does not seem like it's responding to your standard Lyme treatment, then that increases the chances that maybe you do have another co-infection sitting there. Okay. So, I wouldn't say your symptoms, what you're saying here without the night sweats are screaming Babesia, but there's that possibility. So when we start wondering, could there be a co-infection, the odds of a co-infection being there go up with the more difficult it is to get the Lyme and Borrelia under control. In other words, if things aren't getting better with your standard Borrelia Lyme treatment, then there may be another infection sitting there that's limiting your ability to get well. And that could be a Babesia, that could be a Bartonella. These days, the best test that I like to do for looking at Babesia is that immunoblot that you just mentioned there. And so that's a test that is unique to IGeneX. No one else does this test. And what they're doing with the immunoblot is they're looking to see if your immune system is making antibodies against 2 specific strains of Babesia. One of those specific strains is Babesia microti, another one called Babesia decani. And in addition, they look to see if you are making antibodies against the whole family of Babesia. And we think there may be about 15 different strains of Babesia. And one of the bigger ones that's getting attention these days is a strain called Babesia oticoli. And it may be that the predominant strain of chronic Babesia is oticoli, actually. So IGeneX doesn't have a specific Babesia oticoli test, but if the family test comes back positive on your immunoblot, then it means you got it, okay? I don't usually recommend that people get the other test that IGeneX has, which is this test called a FISH test, or a PCR test, either one of those, because I think the odds of finding it with those are very small. I think I find better results with just going with that immunoblot. So yeah, I think from what you've described here, I probably would recommend doing that. Okay. All right. So everyone, and when you do the immunoblot, you want to get, these immunoblots measure antibodies from two families, IgM antibodies and something called IgG antibodies. So you want to get the IgM immunoblot and the IgG immunoblot from IGeneX. That's the way I would go with that. All right. All right. Let me do a quick screen share here for you. All right. So this is my online information site where I have my online Lyme guide. And let's look at in the immune system section is where you're going to find my article on Lowdose Naltrexone. And this is the article right here. Okay. So take a look at that. Gives you the information about how to use Lowdose Naltrexone and how it might be working as well too. All right. And then the other thing I recently did in my article, I have an article about how to diagnose Babesia, and I did update it recently, and you can find that article here. And basically what I did in this update is I talked about, I gave more information about a review of the testing. Okay. And so you can read about you can read about it here. All right. I don't know if I put the test number down. I need to come back and update this article and actually give you the testing number from IGeneX, but in their order form, just look for immunoblot and in the Babesia section and you'll find it. Okay. All right. All right. There you go. Good luck to you, Craig. Thanks for a question. Hello, Sherry. Let's see. I've heard that baluki has some blood thinning properties. Is baluki safe to use to treat Babesia while on blood thinners? Xarelto. Well, that's a good question. So they're both. So what baluki does is it breaks down a blood clotting protein called fibrin. And fibrin is basically what holds your platelets together and can stop bleeding, basically. Generally, when I've got somebody on another blood thinner, I don't like using two different ways of blocking blood clotting, and so I probably would recommend against doing that. Okay, that's my opinion. Other doctors may have a different opinion on that, but I think I would recommend against that. All right. Good luck to you, Sherry. Hello, let's see. What medications or supplements have you found to be useful in cases of neuropathy on the tips of the fingers and toes? My neuropathy started 3 days after I started Plaquenil. I stopped taking it, but the neuropathy remains on the tips of fingers and toes. The skin in that area has been hardened and gotten itchy and changed colors. Any suggestions? Thank you. Yeah, so, quinine-like medicines, like Plaquenil is a quinine-like medicine, and then there's quinine. Either of those can sometimes lead to neuropathy. So that's not, it's rarer, but it's not uncommon, all right? And so what I like to do when I have a person that develops neuropathy for any reason, there are some things that I find helpful. Number one, I'd like to have people take glutathione. So glutathione is a very strong antioxidant that is made in every one of our cells. And its job inside of our cells is to fix injury, basically, fix damage due to oxidation, okay? So I'd like to get people on that. The product I like for that is I like using a liposomal glutathione product. And the reason I like to use liposomal is the liposomal means it's glutathione that's microscopically wrapped in fat, which increases absorption. Glutathione on its own is destroyed pretty easily in the gut. but there are certain companies that formulate with these liposomal preparations that get increased absorption. The company that's got really good data showing that they actually do get increased absorption, you get adequate levels of this within your red blood cells, is what they follow, but probably in every cell, is Research Nutritionals, and their product is called Tri-Fortify Orange and Tri-Fortify Watermelon. And I like, when I'm treating for neuropathy, I like to go pretty high on it. I like to do a teaspoonful twice a day. And I believe their teaspoon is 450 to 500 milligrams, somewhere in that range is what a teaspoonful is of the glutathione. Okay, so teaspoonful of that Tri-Fortify product twice a day is it would be the glutathione. All right. Second thing that I like to do is repair the injured nerves from the outside. So glutathione is repairing from the inside. Keep in mind that your nerves make glutathione, but if they're injured, they may have exhausted their gas can or their glutathione gas tank, if you will. The glutathione tank may get empty, and so you need to fill it back up. Okay, all right. So then the other thing, what happens, so your nerve cells, the cell itself, is the outer covering on the cell, or the cell membrane, that is made up of a double layer of fat, or we call that a bilipid layer. And that bilipid layer can also get injured too. And so the one thing that I like to do with neuropathy is fix the membrane of the injured nerve as well too. And the product I like to do that is another product by Research Nutritionals called ATP 360. It's a mix of phospholipids. In addition, there are a number of micronutrients in it that will help your will help with the repair. Specifically, the ATP 360 has, again, these phospholipids that make up the nerve cell membrane, but also it's the same phospholipids that make up the covering of your cell energy factories called mitochondria. So if you can repair both basically. And the ATP 360 has nutrients for the mitochondria. So your cell energy factories will work better to help with some of the repair as well too, okay? And that product, you want to do 3 pills 1 time a day. And so with my patients that have neuropathy, those are 2 of the things that I wind up doing. The other thing that you should talk with your doctor about is to make sure they did some standard blood testing to figure out if there's another cause for the neuropathy. So a vitamin B12 level, thyroid studies, and a regular kidney liver testing, something called a comprehensive metabolic profile, would be some basic things you want to look at from a blood testing standpoint to see if there's other things that should be corrected as well too. Okay, all right. So let me just do a quick screen share here for you. All right, so I do have an article about neuropathy. And so in addition to what I said, you could take a look at that article. And I think it's going to be in my brain and nerves section here. Take a look at this article called Peripheral Neuropathy Evaluation and Repair. And the one thing I want to let you know that I did talk about in here is I talk about some of the basic blood testing you should get, okay? So anyhow, it's a little more extensive than what I just told you, but these are some things that you might want to talk to your doctor about just to make sure. Okay. All right. And then in terms of the 2 products that I was just mentioning to you, so this is my store, Marty Ross MD Supplements. And so if you're looking for which products I recommend that I use with my patients, and if you use with my patients, you can look here. And what I've tried to do is take the guesswork out of it for you. I've gone out and tried to find the companies that really do put in their products what they say they put in the product. And I've also looked to try to find companies that use high quality ingredients. Okay. So there's a lot of garbage out there in the world of supplements, but I've tried to make it a little bit clearer. I've curated what I would call effective products. If you order from me, keep in mind, if your order is over $50, I pay for the shipping. And I cover your taxes. If you're in an area where you have to pay taxes on these kind of products, I pay for that on your behalf. All right. All right. So in terms of the 2 products that I was just talking about, let's go ahead. I'm going to look under Research Nutritionals. Okay. And so the ATP 360, interesting. Anyhow, this is our ATP 360. I'm not quite sure why I'm showing a list price scratched out, but anyhow, there you go. And so that's the ATP 360. And then the glutathione, this is the glutathione, okay? All right. All right, good luck to you. Hello, Doug. Hi, Dr. Ross. I've heard you describe mold colonization as breathing in mold spores that grow inside you and release mycotoxins. You've indicated that blood tests for mold spores are not a good way to test for colonization because the spores may or may not be releasing mycotoxins. What if the spores identified in a blood test match, at least in part, the toxins revealed in the real-time mycotoxin test? Does that mean likely colonization? Thank you. It's a good question. So the blood test that you're talking about is an ELISA test that is actually measuring whether you have made antibodies against various mold spores. Okay, the blood test is not measuring the toxin levels, but rather it's measuring whether you've had an immune reaction against various kind of mold spores. And it is possible that if you've been exposed, if you've had mold spores in you and your immune system takes care of it, you're going to still continue to have that immune reaction even if the mold spores are gone. So having an immune reaction doesn't prove you still have those mold spores there, basically. All right. So in my opinion, the best way to know if you have a mold toxicity problem is do your urine test, see if you actually are peeing out excessive levels of mold toxins. And then if you treat your mold toxicity by binding up those mold toxins, and you do that for about 6 to 9 months, and if there is no improvement on your real-time test, then you have to start wondering if you have one of two problems. One, are you being exposed to mold toxins in your environment? Are you living in a clean home or a home that's contaminated? Is your work contaminated? Okay, so you have to worry, are you still being exposed? Okay. Number two, there is always that possibility if you're sure that you have a clean environment that you may have colonization going on. So the way we get at the question about whether you have colonization that's producing mold toxins is we, first of all, start binding up your toxins and we see if you get better. And then if you don't, then we have to wonder, could it be from colonization or could it be that your home environment's a mess? So if you haven't checked your home environment, check that, make sure you're not getting it there. And if that comes back, if your analysis of your home, your company comes in and looks to see, do you have mold in your home? If they find nothing, then you have to start wondering, could it be that you actually have mold spores living in your sinus passages or your intestines producing the toxins? Okay, all right. So everyone, I kind of got ahead of the game here. Most of you may be familiar with the idea of mold toxicity, but let me just give you a brief background on that. So what happens in people that have mold toxicity issues? Well, there are 25% of all people that have a genetic programming defect where when they breathe in mold toxins, they can't get rid of those mold toxins, all right? And so what happens in 75% of us is when we breathe in mold toxins from the world around us, those mold toxins go through our lungs, get into our bloodstream, and some of our immune cells will see those toxins and tag them, and then other immune cells will come in and break them down. So 75% of us can walk through a building full of a cloud of mold toxins and never have trouble because our immune systems will deal with it, okay? Now, that 25% of people, what happens is they breathe in those mold toxins, and due to a genetic programming problem, their white blood cells do not tag the toxins, so they don't get broken down. The next step in the process then of trying to clean those mold toxins out is they go to the liver. And the liver is supposed to be able to transform fat-based toxins like mold toxins into water-soluble toxins and then expel them out into the intestines. Well, the liver doesn't do that well. And so it doesn't transform them to water-soluble toxins. And so they get moved out into the intestines as fat-based toxins. And as a fat-based toxin, they don't mix in our poop. They literally just get reabsorbed right back into your bloodstream again. So you get this endless loop going on. And those toxins have direct effects that are toxic on you. And in addition, the big thing they do is they trigger the release by your immune system of a group of chemicals called cytokines. And cytokines are good and bad, but when they're made in excess, they give you all those symptoms that we call Lyme and mold toxicity symptoms, because Lyme also triggers too many cytokines. So too many cytokines give you fatigue, brain fog, headaches, body pain, hormonal dysfunction, insomnia, etc. All right. And so mold toxicity often can look just like tick-borne infections do, because the end result is they both trigger too many cytokines. All right. So the way we handle mold toxicity, we'll make sure you're not getting exposed in your environment. So we have, if you are discovered to have mold toxicity, and we wind up having people get analysis of their home environment, work environment, to make sure that they're not being exposed there. And if they are, then you need remediation or you need to move out of that place. Second thing that we'll do is we put people on substances that bind up those mold toxins as they get into the intestines. And we call those binders, okay? And then we wait and see. We retest in about 6 to 9 months. And if things are getting better, great. If they're not, then we start considering, do we need to put you on something that will kill for mold colonization or mold spore colonization, okay? Now, I know there are some providers out there that the minute they discover that somebody has mold toxicity, they will wind up putting them on antifungal agents to kill those for the possibility of mold colonization. I disagree with that approach. The majority of people that I've treated for mold toxicity in my practice, I get well without ever having to put them on something to kill for mold spores and those mold spores producing the toxins. Okay. All right. Let me just do a quick screen share here if anyone wants to look a little bit further into what I was describing here. All right, so let's take a look at in my I think I have, it would be in the detoxification. The detoxification section, my article on mold toxicity is called Mold and Lyme Toxin Illness, okay? So you take a look at it there, where I talk about how do you evaluate and how do you treat it. Good luck to you, Doug. Hello, Denise. Hi, Dr. Ross. My son has Bartonella and psychiatric symptoms. He's been treating with antibiotics and diflucan, and things are getting much better. Great. I've done some blood tests on him, and most of his complement C3, C4, CH50 came really low for his age. Also, his immunoglobulin A is also low. His immunologist thinks that maybe it was provoked by an autoimmune disease, and this might be the cause for inflammation and encephalopathy. He wants some more tests, but thinks IVIG would be a solution. He is not an LMD, so he doesn't take Bartonella seriously. Do you think that Bartonella can provoke the reduction of these markers, and after clearing it, they will be back to normal? Or it's the other way, and because the markers are low, any disease may provoke the psych symptoms? Good question. So everyone, complements are a protein system other than antibodies that the immune system uses to fight infection. It's kind of a simplified discussion of it. And if you have low complement levels, it's hard to deal with intracellular infections like Bartonella. Okay, so the question is, you ask a good question. What came here? What came first, the chicken or the egg? Right. So, did Bartonella trigger the reductions, or does your son have the reductions, which made it easier for Bartonella to get a foothold? And to be honest with you, there's no data on that. I can't tell you what came first here. And in my experience, I so rarely see these kind of complement reductions, and it's hard for me to say based on experience too. My approach, usually when I've got somebody with an autoimmune illness like this or suppression like this, is to actually get the support and do an IVIG. That has generally been what I recommended to my patients. And the reason is, to treat an infection, you can kill all you want. You can keep killing germs, but you really need to kill germs and have an immune system that's stepping in to help complete the job too. And so, especially in chronic illness, you want to have everything firing well. You want the antibiotics to be good, and you want the immune system to be firing well too. And so, yeah, I would, if your son was a patient of mine, I would be recommending to my patient an IVIG. And it sounds like, so that's what I would consider. Okay. All right. Good luck to you, Denise. Good luck to your son, that is too. So everyone, IVIG is intravenous immunoglobulins. So giving antibodies basically. And these, the difficulty with IVIG is it can help, but the way that the product is made is it's basically there are donors that give blood, and their blood is cleaned, and the IG antibodies are withdrawn, and to come up with a treatment, it's actually multiple samples are pooled together to give you one treatment. So there's always a risk of doing IVIG that you also are possibly getting exposed to other infections from that other product, right? They are screened for infection, but you still have to wonder about that. So I usually am cautious about using it, but there are certain situations, especially with immune suppression, where I think it's worth going forward and doing that. Okay, all right. Good luck to you, Denise. Hello, Maria. Dear Dr. Ross, you have already answered my questions. I'm very grateful for that. Good. Let's see. Could you please share a few words from your experience? 1, chronic Lyme and thrombosis. Is there a connection? And 2, what would be considered when taking, or what should be considered when taking nattokinase? So thrombosis or blood clot, it is possible that having chronic infection, and that could be Lyme, chronic virus infections, Bartonella, Babesia. Chronic infections can trigger one of the immune responses that can happen from chronic infections is the immune system will make larger amounts of the blood clotting protein called fibrin. And when you get large concentrations of fibrin, that can lead sometimes to more easy blood clotting, or in theory it can, all right? Now, there's no one that's done a lot of research looking at that, like what's the increased chances with chronic infection of having thrombosis, but in theory, there is the possibility that can happen. So there are various enzymes that can break down the fibrin in these clots. The strongest enzyme at breaking down fibrin is lumbrokinase. Nattokinase is, I think it's about 100 times less strong. It works, but it's 10 to 100 times less strong. It's somewhere in that range, okay? I tend not to use it because I like the power of lumbrokinase, all right? I can't tell you what the dose of nattokinase would be because I just don't use it because it's weaker. I can tell you in an adult how I would dose a lumbrokinase, which is lumbrokinase comes either as a 16 milligram or a 20 milligram pill, and I would start at 1 a day, and as tolerated, then I would go up to 1 pill twice a day. The one thing to keep in mind, if you have chronic infection like chronic Lyme is that you may get greater killing when you start a nattokinase or a lumbrokinase, because in addition to breaking down the fibrin in these blood clots, they also, or fibrin in general in your blood, they also break down fibrin that is part of what is known as biofilms. Biofilms are a slime layer, sugar slime layer held together in a fibrin protein skeleton that can cover germs. And when you start removing that biofilm, that exposes the germs to your antibiotics and also the immune system, so you can sometimes get a Herxheimer reaction from that. Okay, all right. The other thing about taking a nattokinase or a lumbrokinase is you want to make sure to take it on an empty stomach. Water is okay, but no medicines, food, or supplements. And I usually recommend beginning that you stop all your medicines, food, or supplements beginning an hour before you take your lumbrokinase or nattokinase through an hour afterwards. Okay. All right. Good luck to you. Hello, Cesar. Let's see. My daughter is treating for BART for almost 5 months, doxy, diflucan, cinnamon-clove, oregano, plus lots of supplements. She was without symptoms for 2 months already, depression, brain fog, anxiety, panic, and dark thoughts. She got COVID last week, just a day with fever and sore throat. This week, she is better from COVID, but started feeling anxious and stressed. How should I handle this? Wait for the after COVID cell by itself or give some extra supplement? I heard about giving aspirin for a month. Is it right? Thanks a lot. All right. So when somebody gets COVID, it triggers your immune system to make cytokines and to make excess cytokines. Okay. Now that probably sounds pretty similar because that's the same thing that Bartonella does, and that's the same thing that Lyme does. All right. Excess cytokines trigger psychiatric symptoms in some people. All right. So what I have done with my patients in my practice that got COVID and had a deteriorating of their mental health is I would usually work with glutathione. Your daughter may already be on glutathione, but I usually would work with glutathione to help reverse some of that excess cytokine situation. And the adult dose that I would use is up to 500 milligrams twice a day. I don't know how old your daughter is here, but roughly that dose of 500 milligrams twice a day is for a 150 to 175 pound person. And to develop a pediatric type dose is basically take their pounds divided by a 175 pound person, and you've got a ratio that you would use to calculate what dose they might use on the glutathione. Okay. And if the other thing I would do, if I think it's cytokines triggering more psychiatric symptoms, in addition to that glutathione, I would wind up using curcumin. Again, an adult dose I like using on that is 500 milligrams 3 times a day. And I like using a product made by Thorne called a curcumin phytosome. The reason I like using curcumin phytosome is it's curcumin microscopically wrapped in fat, so liposomal curcumin, which increases its absorption too. Okay? All right. Good luck to your daughter. RC Lopez. Hello, Doc Marty. I wanted to know why some doctors take their patients off binders for a week or more before they test and some do not. My friend was taken off binders, first test 7 days, second test 5 days. She got worse both times, and the test showing an increase in mycotoxin, and it took months to get her back. And she was starting to feel well before being taken off. Then it was like starting over. When I was with you, I was never taken off binders to take real-time lab, and my test was accurate, showed exposures when I had them. Detoxing after an exposure, and when I was getting better, when 3 of the 5 went not present, it correlated with my symptoms almost feeling gone. My symptoms were going away down to almost nothing. Also, if not sensitive, why use Welchol over cholestyramine? I was told cholestyramine is the strongest, and I used it. My friend is on Welchol, and she was told Welchol was the strongest. Thank you for all you do. RC, also, what is the difference between mast cell and SIBO? Well, I didn't get the full question there, RC. Let me look at the parts that you do have here. So some providers like to take their patients off of binders because they're concerned that if a person is on a binder, that binder is actually going to give the test a false positive low number. In other words, if you're on a binder and it's binding up the toxins, then that's going to cause the test not to show the toxins because you're binding and pulling them out, right? Well, I disagree with that approach. I leave my patients on binders. And the thing is if you still have significant toxins in you, it doesn't matter that you're on binders. The swimming pool of toxins in you is still going to show up. That binder is like a drop in the bucket compared to the amount that you have in you when you're doing testing. So I don't agree with what some people do, but that's probably why they're doing it. Okay. In terms of Welchol and cholestyramine, I look at those two as probably being equally effective. There are no head-to-head studies that have been done saying is Welchol a better binder than cholestyramine, but the way they work is basically the same. So I consider them to be equivalent, basically. All right. I hope that gives you the answers you were looking for. Thanks, RC. Hello, Winter. Let's see. Hi, Marty. Could you please explain what would cause the entire soles of the feet, not just the balls of the feet, to hurt with Bartonella? Is it more likely to be vascular or nerve or a combination of both? And can it be cured? I have had this type of pain for 10 years and is only relieved by raising my feet up above the knee level. Thank you so much. I have to be honest with you. I don't know the specific mechanism why people get pain on the balls of the feet in Bartonella. The classic Bartonella foot pain is on the balls of the feet. There is an occasional person I have seen in my practice that had the whole bottom of the foot tender. A classic thing that happens with Bartonella foot pain, though, is that usually it's worse first thing in the morning. And as you start walking around, it will get better. If that is not the way your foot pain is occurring, then, and I hope you probably have done this already, but I would consider having a podiatrist take a look at you and see if they can find another cause of that pain. I've never seen anyone in my practice that elevating the feet above, as you're suggesting here, helps them, or as you've experienced here, helps that kind of pain. But there are so many unique ways that Bartonella behaves in people. And so even though I never saw it, that raising feet made a difference, that doesn't mean it's not Bartonella. But the fact that it's a whole bottom of foot and treating doesn't seem like it's made a difference for you, I would be looking at non-Bartonella causes for your foot pain. Okay? All right. Thanks for that question, Winner. Hello, Lynn. Let's see. Hi, Dr. Ross. What are the best single ingredient candida killing herbal supplements that can be used alone or layered in one at a time for those who are sensitive and may react to multi-ingredient formulas? 2, do any of them also work on SIBO? And 3, also I see that Thorne has a curcumin phytosome product that is a lower dose, 250 milligrams, so 500, and it's sustained release. The lower dosage and the sustained release could be good for me for various reasons if the sustained release works and the product is well absorbed. Are you aware of the performance data on this product and similar to that for the Mariva 500? Would you recommend this? So, I haven't I'm not aware of the data on the 250 milligram sustained release product, right? So I can't comment on that. I'm sorry, I don't have that information. So I don't know how it performs relative to the 500 milligram product. In terms of single ingredients that could work on a yeast, so any of the volatile oils like oregano, thyme, clove, any of those oils can be useful against yeast. Other single ingredients you can find a caprylic acid pills. I believe Now Formulas makes a caprylic acid pill. Garlic pills, some are garlic, not even just pills, but garlic. You could crush a clove, not a head, but a clove of garlic, put it in water, swallow it down, and the act of crushing garlic activates a chemical in it called allicinin, and that can be effective against yeast in your intestines too. In terms of things that would work on SIBO, oregano would work on yeast and could work on SIBO. Garlic could work on yeast and could work on SIBO as well too. So those would be some things that you might consider doing. Okay. All right. Good luck to you. Hello, Beth. Hold on here just a minute. Let's see. Hello, Dr. Ross. You're truly a lifesaver for all of us here. Thank you for saying so. I'm glad you're getting benefit. My son started on Cryptolepis a few months ago for Lyme. Recently, he has been experiencing headaches about 1 to 2 hours after taking his dose. He's following the dosage listed on your website. He's done an elimination process to make sure it's not any of the other herbs or supplements he's taking. Have you ever seen headaches as a side effect of Cryptolepis, or could it be a hoax? What are some of the common symptoms of any of Cryptolepis that your patients have experienced? Does Cryptolepis build up in your system over time? Ironically, it seems to be reducing his other Lyme symptoms, so we'd like to stay on it if possible. All right. So from what you have said here, I know he's tried by process of elimination. I assume he's probably started and stopped the various products to figure out which one's leading to the headaches. I think I gather that. If not, he may want to stop the Cryptolepis and see, do the headaches go away? It sounds like that's what you've done here already, but I just want to clarify that, okay? So I haven't seen people get headaches on Cryptolepis, but there is a Marty Ross MD rule of medicine, which is anything can happen to anyone with anything. All right. So that means that all of us can get side effects to things that we take that no one else gets, right? Because we're very unique, and each of us are very unique in our chemical processes, the stresses we're under, the food we eat, etc. And so it could be something unique to him. If he's already clearly determined that it is Cryptolepis, you might, even though for an adult, I do suggest a very high dose. I mean, it's a high dose of Cryptolepis I suggest, which is a teaspoonful 3 times a day. I have found people do good on a quarter teaspoon or half a teaspoon too, right? Maybe not, it's greater chance of helping, but they still do good, right? So if he's clear that it is the Cryptolepis, he's done the experiment of stopping it, the headaches go away, then the next step would be to find a dose that is tolerable, that doesn't trigger the headaches, okay? And you might start by just cutting to half the dose that he's on and see, does that give headaches? And if not, then gradually increase until you find a level that triggers the headaches, and then give the amount just below that, all right? That's what I would do with my patients. I would work with them to find a dose that is tolerable in terms of side effects, basically. But no, I have not seen that. I mean, the major side effects of Cryptolepis is the taste is horrid. And it can trigger Herxheimer reactions. And so those are the main things that I have people experience. Sometimes nausea, sometimes diarrhea, but I haven't seen anyone have headaches on it before. All right. Okay. Good luck to you, Beth, and good luck to your son. Thanks for that question. Hello, Sue. Hi, Dr. Ross. Can a person test positive for Lyme, Borrelia, and Rickettsia 2 separate times, 8 months apart, from 2 separate labs, IGeneX, IFA, Armin Labs, and have atypical symptoms? My husband has non-migratory and constant muscle tightness that causes severe pain, mostly in his legs. There is no muscle weakness, numbness, or tingling. However, there is muscle atrophy, electric shock-like vibrations. He doesn't have more common symptoms like brain fog, mental issues, fatigue, or joint pain. He's been treating with antibiotics and supplements since last summer with no improvement, only worsening. His LMD and ND also questioned this. Also, his tick bite happened in May of 2018 and was treated with the wrong antibiotic for 1 week, but no lingering symptoms until he got the COVID vaccine July of 21. Thanks for your response. All right, let me see here for a minute. I want to look back through the question here just a minute, Sue. So, so when you're looking at Lyme testing, so it looks like you've had antibody testing. The IGeneX, IFA, and Armin Labs was an IgG, not their ELISpot, I think what you're saying here. So IgG antibodies will be positive and will stay positive. They're the memory of your immune system. So even when an infection is gone, your immune system will keep making IgG antibodies. So even 8 months later, okay? The thing that's interesting is IgM antibodies is what you first make whenever you get sick with something. That's the antibody family that's made first. IgMs get made, and eventually they go away and they get replaced by the IgG antibodies, okay? For Borrelia, we know there's good data that says that about 50% of people continue to make IgMs even months down the road, years down the road, even though they're not supposed to. And we're not sure why that happens, but it is a phenomenon that happens. And then they just don't go away, okay? So I would not expect that IgG antibodies would go away, even if the germs are gone, okay? Now, I know that the testing has said Borrelia and Rickettsia, all right? Generally, Rickettsia is fairly straight, easy to treat with about a month of doxycycline or a tetracycline. Obviously, Borrelia, Lyme, can sometimes take longer. When I've got somebody that has a lot of tightness in the muscles, numbness or tingling, electric shock-like vibrations, I start also wondering, could there be some Bartonella? Okay, I sometimes wonder that. And so I often will either add in treatment that would cover for the Bartonella, or now that IGeneX has such a good test, their immunoblot, I would look at doing an immunoblot, which has the ability to find Bartonella if it's there about 90%. So it's a 90% sensitive test. And so I would consider doing the IGeneX immunoblot. Now, I like the IGeneX immunoblot better than going back to Armin for an ELISpot. So Armin ELISpot is only looking to see if you have T white blood cell reactivity against a strain of Bartonella called Bartonella henselae. We know that there are actually 15 strains of Bartonella that can infect people. And the lab that does the best job of detecting reactions against all 15 strains is IGeneX. Basically, their immunoblot looks to see, their Bartonella immunoblot looks to see, are you making antibodies against 4 specific strains? So Bartonella henselae, Bartonella cantana, Bartonella leishbeathii, and Bartonella. I'm blanking, but there's 4 that they test for. Okay, and in addition, they look to see the whole family. Do you have? Are you having a reaction against the Bartonella family, which includes these 4 strains and 11 other ones? Okay, so they have the best ability to detect Bartonella infection. And from what you've described here, and granted, I don't get to ask you a bunch of follow-up questions here, but what you describe here would have me questioning, is there a Bartonella hanging out here? Okay, all right. Anyhow, in terms of looking how to diagnose Bartonella, you might want to look at my article. I'll show you, do a screen share. You can look at symptoms as well as that immunoblot test, okay? So let me do a screen share here. All right, so if we look at my online Lyme guide and look in the how to diagnose chapter, and then there is my article called How to Diagnose Bartonella and Chronic Lyme Disease. And in here, I talk about the testing and why, the problems with testing, but I also talk about the IGeneX immunoblot being the best test. Vinsoni is the 4th strain of Bartonella. And then I give you symptoms to look at that could also give you an indication that you might have Bartonella as well too, okay? All right. Good luck, Sue. Good luck to your husband. Hello, Isa. Let's see, Dr. Ross. Chris just got a diagnosis of scleroderma. Oh, darn. It's an autoimmune disease, which explains his unusual symptoms. It seems unlikely to have caused his fatigue for the past 15 years, so we're wondering if it was triggered by the Lyme. Have you heard of scleroderma occurring secondary to Lyme? Any thoughts about whether he should resume his Lyme treatment? Thanks. Again, this is kind of the chicken or the egg question about any autoimmune illness. Yes, there is the possibility that Lyme and tick-borne infections trigger autoimmune illness, like scleroderma, like lupus, like rheumatoid arthritis, for instance. Okay, there is that possibility. But it's also possible that people just have 2 independent illnesses. And usually scleroderma, as you suggest here, is not going to give you the fatigue. So you have to wonder, is some of his symptoms still part of from Borrelia? Possibly, okay? The one thing that I consider when I treat somebody that has developed autoimmune illness, and I discussed this earlier tonight, I would look at low-dose naltrexone. I can't remember whether Chris has done that before or not, but low-dose naltrexone, give it a 6-month trial, sometimes can make a difference here. As to whether to keep treating the Lyme, I know Chris from previous questions here has had a very complicated course. And if he's treated for years, and I'm talking like 5 years or longer, and got nowhere with the Lyme germ treatment, I would think you probably have given a good run at that. And it may be time maybe to focus on the scleroderma and see if that can make a difference for him. Okay? All right. Good luck to you, Isa. Good luck to Chris. Hello, Sue. Let's see. Hi, Dr. Ross. Thank you for hosting these sessions. You're welcome. And for posting your protocols so clearly online. Could you please comment on the relationship between Babesia and heart complications? What protocols and testings do you recommend to diagnose and treat cardiac complications from Babesia? Also, could you comment on stem cell therapy for Babesia? Thank you. Let's see. Sue, here is my background for clarification. I got Lyme hiking in New Jersey in 2016, but it went undiagnosed until 9 months later. I have been treated for Lyme, Bartonella, and Babesia since diagnostic. And the one infection that keeps flaring up is Babesia. Last fall, after 40 hours of hyperbaric oxygen treatments, the Lyme and Bartonella symptoms disappeared, but the Babesia seemed to get markedly worse. Your online Babesia protocol convinced my Lyme doctor to treat me with azithromycin and some antibabesials, and it really helped. It did not include the lumbrokinase. I also did 3 sessions of ozone therapy. All right, let me see if there's more here. So Sue, I want to make a comment. So, and what I'm going to say, no, there's no data behind this, but just be here with me. So Babesia lives inside your red blood cells, right? And so it lives in an oxygenated environment. I don't know that giving oxygen is good for Babesia. In other words, I'm wondering if getting the hyperbaric oxygen may have made the Babesia worse. That's in theory. No one has done any studies about this, but keep in mind where Babesia lives. It lives in an oxygenated environment. It lives in your blood cells and in your blood, right? So it's thriving in an oxygenated environment, basically. So that could be the reason that could be. And again, I'm saying there's no data that I've ever seen on that opinion of mine, though. All right. And then let me see here. Oh, heart complications. So one of the things that happens with Babesia can trigger a lot of POTS type symptoms or imbalance between your adrenaline, anti-adrenaline system. All right. And so you get surges of adrenaline that can cause your heart to race. And then suddenly there's not enough adrenaline there and you get low blood pressure and you get lightheaded and dizzy easily. All right. So those are the main heart symptoms that people have, but it's more due to, I guess technically we call it dysautonomia. You have dysregulation in the epinephrine or adrenaline, anti-adrenaline levels that are supposed to be directed by your vagal nerve. And for some reason, Babesia leads to a lot of this dysautonomia. And it's not clear to me the mechanism. I haven't seen the explanation for it, but that is what happens a lot with people that have Babesia. So you get periods of racing heart, you get adrenaline surges. That's why you get night sweats. That's why you get headaches a lot. But those adrenaline surges also can give you racing and skipping of the heart. And then suddenly, because there's just dysregulation of all this, there's not enough adrenaline there. There's a lot of anti-adrenaline that's released, and you get low blood pressure periodically as well, too. Those are the main heart symptoms that people get with Babesia. I have not seen any other cardiac complications with Babesia before, okay? And again, I wonder about the oxygenation and whether it's ozone oxygenation, because keep in mind that's converted over to oxygen too, or whether it is hyperbaric oxygen. I'm not clear that those really are a good idea for somebody with Babesia. Theoretically, I wonder if it causes problems. Okay. All right. Good luck to you, Sue. Hello, Kelly. Let's say Dr. Ross. I wonder if you could advise the best way to incorporate IV antibiotics, particularly ceftriaxone, into an effective treatment plan. Should other antibiotic herbals be taken at the same time or on off days? And what should be taken after the IV course is finished? My mom, in her 80s, after first being diagnosed with Lyme and Bartonella a couple of years ago, was given 4 weeks of IV ceftriaxone Monday to Friday with rifampin and azithromycin at the weekends. Her liver, however, did not respond well to the rifampin, and so it was stopped. Her neuroborreliosis responded really well to the IV ceftriaxone, but she relapsed within a few months, presumably because the other forms of the germs were not addressed. She has since trained oral doxy and ceftriaxone, or tried oral doxy and ceftriaxone with no symptomatic relief at all. Her neurosymptoms are back with a vengeance, so she is keen to return to ceftriaxone IVs, but would like to know what she should combine it with. Her doctor has suggested fluconazole, and importantly, should she take the other antibiotic herbals too? All right. So, so when I use ceftriaxone, there's a couple ways I use it. One, just the ceftriaxone. I'll talk about your other antibiotics here in a second. But the ceftriaxone can be used either 4 days on, 3 days off. And when I do it that way, I use a high dose. I do a gram in the morning and a gram at night. Okay. And the reason, so what that does, the way that ceftriaxone works best is if you maintain high levels in your blood. If you only take it one time a day, you get a peak, but it doesn't stay elevated, versus twice a day, you get a peak and then it will stay elevated. And so you get more effective killing that way. The trouble with that though, is it's hard on the liver to take it at that kind of high dose. So we'll usually use it for 4 days on, 3 days off. Okay. All right. And I will have people take their other antibiotics on the same days as the people take the ceftriaxone. So I'm not sure why your doctors were doing something different with that. I've had no problem having people take ceftriaxone and then having them take other herbal antibiotics or prescription antibiotics on the same days, and even the days they're not on the ceftriaxone. Okay. So the one thing about the ceftriaxone too is I usually like to have people be on it for at least a month or 2 months after their symptoms resolve that you're trying to treat with it. Okay, so just keep that in mind. Okay, now the ceftriaxone it does get good brain penetration. It is useful at treating the spirochete form of Lyme. And there is some evidence that maybe it goes after cysts, but it's not clear. Okay. So the problem is, though, is if you use it by itself, you are only going to be treating spirochete and the cyst form of the germ, and that you need to be on something else that will pick up intracellular. Okay, so Lyme that lives inside the cells, and the intracellular agents are either going to be the tetracyclines, so doxycycline, minocycline, or they're going to be the macrolides like azithromycin, clarithromycin. Okay. All right. Now, that evidence that ceftriaxone also picks up the cyst is limited. So I usually want to have people on something that is also going to treat the cyst form of the germ as well too. All right. Now, what I've just described is the form, the appearances of the germ. All right. And then keep in mind that these different forms can be growing, or they can be hibernating, or we call those persisters. All right. So, the way that if I had somebody like this, what I would do is probably get back on the ceftriaxone. I might work with instead of diflucan, I might actually use tinidazole. And the reason I would use tinidazole is it can get inside. It may have some intracellular activity, so it might also help with the intracellular Lyme. There's some good evidence that it can help break down biofilms as well too. Okay, so 2 antibiotics, all right, that probably is covering all 3 states of the germ. And then in addition, I would consider doing something that is going to help with the persister growth state as well too. And what I like using for that is I like using something called liposomal cinnamon clove oregano capsules, and I like having people take 1 pill twice a day. All right, so those, talk it over with their doc, make sure that they're in agreement with that. But you might consider instead of fluconazole, actually going with the tinidazole, and they're in the same family, by the way, and doing something that would cover for the persisters. Okay, so in terms of dose, so you could do ceftriaxone, 4 days on, 3 days off, and then doing the tinidazole. Tinidazole actually could be done as a 4 day on, 3 day off as well too. And you could do it on the same days as a ceftriaxone. Okay, and then the cinnamon clove oregano would be 1 pill twice a day, every day. Okay, so that might be a thing for you to consider with your doctor. Okay, all right. Good luck to your mom. Patricia, hello, Dr. Ross. Your webinars are so helpful to me. Great, I'm glad to hear that. I am currently working with an LMD treating Lyme and Bartonella with series of antibiotics. My recent real-time came back with elevated levels in all 5 areas, and I'm treating for that as well. My question pertains to diagnosis from my eye doctor of rosacea blepharitis, which she said can be treated but not cured. I was reading your article on Lyme and autoimmune and wondering, have you had patients with this condition? Do you consider it autoimmune? Any recommendations? I have been on LDN for about 2 months. Thank you for everything you do. I haven't seen, great question. I haven't seen anyone. So everyone, Patricia's talking about is, I think a couple of weeks ago, I published an article about autoimmune disease and tick-borne illnesses. Okay. I'll try to show you that here in a minute. And the main thing that I do when I have somebody with autoimmune illnesses and tick-borne illnesses is I like them to be on low-dose naltrexone. So you're already doing that, okay? But you need to give the LDN at least 6 months to see if it's going to make a difference. 2 months is too soon to see at this point. I have never had a patient in my practice that had rosacea. So I can't speak from experience as to whether that will clear once you get the Lyme under control and once you're on low-dose naltrexone or not. But what I would keep doing is working on your tick-borne illnesses, considering they might have triggered this autoimmune illness, and work with the low-dose naltrexone. Okay? All right. Good luck to you. Thanks for the question. Let me see. Let me do a quick screen share here again. All right. So if you're ever wondering what's the latest thing I published, take a look over here and this is the latest tab. And this is the article that I released a couple weeks ago, I believe, on how to manage autoimmune diseases and Lyme and related infections. Okay. All right. So that's the article that she was talking about. And in here, I talk about low-dose naltrexone as well, too. All right. All right. Hello, Miranda. Let's see. We'll try keep brief as possible. I've been sick 13 years, was diagnosed with Lyme 2 years ago, did 8 months of treatment with no success, treated for mold, had just added antifungal nasal spray, and then got pregnant a month into treatment. I'm wondering if it's recommended that I treat while pregnant to prevent transmission. Is it odd that I didn't respond to Lyme treatment? What treatment would you recommend? Is there any risk taking azithromycin? When do you recommend starting treatment? Also, how to know what phase you're in, intracellular, extracellular? Thanks so much. All right, hold on here just a minute. Okay. So let me make some comments here. So first of all, anything I recommend, talk it over with your doctor, okay? Because I'm not your doctor, and especially with pregnancy. So I'm just going to give you some ideas to consider with your physician, okay? All right. So I understand you didn't get better after 8 months on antibiotics, and then you started working on mold toxicity, okay? So let's just talk about how quickly people can get better with the Lyme infection by itself. So there's been some studies done, or a study done, looking at how quickly people turn around, okay? And in that study, what was shown is that by 3 months of treatment, people with Lyme start, about 30% of people will start having improvement. By 6 months, 60% will start having improvement. And by 9 months, 90% will start having improvement. So with Lyme, it often takes time. And the fact that even after 8 months, you didn't have any improvements does not mean it's not Lyme, okay? I want you to be aware of that, okay? Second thing is mold toxicity and Lyme look the same. And it's possible, and the reason they can look the same is both Lyme and mold toxicity trigger your white blood cells to make too many chemicals called cytokines, all right? And cytokines are good and bad. On the good side, cytokines turn the immune system on to fight infections better. They help your immune system make more white blood cells, and they help bring those white blood cells to where the infection is. Okay, so that's great. That's really good. And they do the same thing with toxins as well too. However, in mold toxicity and in Lyme, if the immune system isn't getting those problems under control, it tries harder and harder, and eventually it makes too many cytokines. And too many cytokines lead to brain fog, body pain, insomnia, fatigue, muscle pain, joint pains, etc. All those symptoms that we call Lyme symptoms and mold toxicity symptoms are really excess cytokine symptoms, okay? Now, when I have treated people, one of the things I try to do when I'm treating somebody is, as part of their first visit, I try to assess whether they might be a person that has mold toxicity, even as the main cause of their problem, even if they have positive Lyme testing. All right. So I had I can give you an example of that. So at one time I had a person that came to see me that was brought in by his mother. He's an adult, but he came in with his mother, who's a nurse. And they had been told by another naturopath in town that he had such bad brain fog and cognitive dysfunction with positive Lyme tests, and that oral antibiotics were not going to work, that he needed to immediately jump on a plane and fly out to see Dr. Jemsek in Washington, D.C. to get on IV antibiotics. And he was in bad shape. I mean, he had really difficulty thinking. That's why he brought his mom in. Mom was his historian. And he had body pain, severe fatigue. He had lost his job. He had lost his family. I mean, things were pretty dire, okay? And so I just asked him, I said, so take me back. When did you get sick? And so again, he had positive testing, but I'm always wondering, what else could this be? Okay. So we talked through, he was doing well. And then he moved into a new building. And it's when he moved into this new house he was in, the house wasn't new, but he moved into a house that was new to him, that he got sick. So immediately I'm starting to wonder, whoa, you changed your environment, you got sick. And so I asked him about the house. I go, did you happen to find any mold in that house? And he said, well, not immediately. He goes, but we discovered there was a room that they had an aquarium in that house. And after we lived in there a while, we discovered there was mold in that place. And I said, were you already getting sick at that point? He goes, yep. All right. So his history said to me, boy, we should look for mold toxicity. So I did real-time urine testing on him to look to see if he was peeing out a lot of excessive mold toxins, and he was. And what I chose to do with him, because the story to me said mold exposure probably is what got him sick. Keep in mind, even if you test positive for Lyme, it's possible your immune system dealt with it, because most of the testing we do, is all immune reaction testing, okay? So if your immune system says you reacted against the germ, that doesn't mean the immune system didn't get rid of it. It could. And so I know he had a positive test. He had all the symptoms that looked like Lyme, but again, all those symptoms are cytokine symptoms, and mold can trigger all that, right? So what I did with him is I didn't go after the Lyme at all. We spent 6 months cleaning mold toxins out, and he was 100% well and went on his way. We never addressed the Lyme. We didn't have to, okay? So the fact that you didn't get any improvements on the Lyme antibiotics for 8 months may just be the nature of Lyme, but it could be, maybe Lyme is not your problem. Maybe it's all mold toxicity. Could be, okay? In terms of transmission, I assume you're talking about transmitting during pregnancy Lyme, okay? And so we know there's studies that say that there is about a 50% risk based on some pregnancy registries that were kept out on the East Coast in the late 80s, early 90s here in the United States, where women that had Lyme were followed to see what happened to them and their babies during pregnancy. And what was discovered in that registry is that 50% of women that had active Lyme that took antibiotics during pregnancy, there was no transmission to the baby. 100% of women that took antibiotics during pregnancy, there was no transmission. For women that did not take antibiotics, there was a 50% transmission rate to the baby. So there's a 50% chance, if you have active Lyme, of getting transmission. Okay, now, what we don't have good studies on is what about inactive Lyme? Because we always wonder when somebody's done treating Lyme, even if they're well, is every germ out or not? We don't know, right? So if you want to be 100% safe and not transmitting Lyme that could be in you, and I can't tell from what you've said here, then the antibiotic I like using for that is either azithromycin, 500 milligrams one time a day, or cefuroxime, 500 milligrams twice a day, or amoxicillin, 500 milligrams 3 times a day. All three of those are safe to take during pregnancy, and they do prevent transmission. Okay, I'll show you an article that I've written about that. Now, in terms of treating the mold toxicity while you're pregnant, whatever they're using as a binder, you need to make sure that there is pregnancy safety data on that, okay? And if they're using antifungal antibiotics, you need to make sure, your doctors need to make sure that there's safety information about taking those medicines during pregnancy, okay? All right. Good luck. So I know I've probably just stirred things up here by saying maybe it's not Lyme. You always have to wonder that when somebody has mold toxicity, it could be that their primary problem is mold toxicity too. Okay. Let me do a quick screen share here for you. All right. So type up here. Okay, so here is an article that I've written. It's called Lyme in Pregnancy, but will my baby get it? What about my health? Okay. And in here, I talk about transmission risk and prevention and what you can do about it. Okay. This is even an article that you could print off and submit, have your provider take a look at it as well, too. All right. Good luck to you, Miranda. Hello, Megan. Hi, Dr. Ross. I'm experiencing extraordinary fatigue and brain fog after getting COVID. It also took me 3.5 weeks to get over the acute phase even. It has been 2 weeks since then, and I'm still dealing with crippling fatigue. About how long do you see post-COVID fatigue lasting for your patients that don't end up with long COVID? I am hoping this doesn't turn into that. Thanks for everything. So, what I have seen personally from the COVID I got, as well as in my patients, is that it can take up to about 2 months for that fatigue to lift. Okay. So I would not, it's very possible this is going to take care of itself still. All right. The things that I usually recommend to my patients when they have this kind of fatigue post-COVID is make sure you're doing everything you can to lower cytokines. So I like doing the liposomal curcumin, that thorn curcumin phytosome, 500 milligrams 3 times a day. I like having people take liposomal glutathione, or the product is the Tri-Fortify watermelon or orange by Research Nutritionals, a teaspoon twice a day. Okay. And then there is the possibility in COVID that sometimes it can trigger mast cell activation. Mast cells are your allergy cells. They make histamines. And there is some evidence that some people, they actually get their mast cells just get overly turned on. So one thing that I would have my patients do also is to try to stabilize those mast cells so not making as many histamines. And what I like using for that is an herb called quercetin. And that's, I would do about 500 milligrams 2 or 3 times a day on that too. And then I would wait and see what happens. But yeah, it just may be, you're going to just need to give this, some time to still clear. I hope you don't have long COVID, but it's too early to say that at this point. Okay. All right. Good luck to you, Megan. Hello, Sandra. Thank you, Dr. Russ, for everything. I'm having a tough time with Lyme. We think Bartonella, COVID a few times, and reactivation of BBV. I cannot tolerate doxycycline even at 20 milligrams. My body burns. Does burning sound like a herx or medication side effect? Is there an herb you recommend for all these issues? Many thanks, Sandy. So burning could be a herx. Could be, or you may be having an atypical side effect to the doxycycline. You might consider trying, rather than doing doxycycline, you might consider using a different prescription antibiotic, which would be something like a clarithromycin 500 milligrams twice a day. It generally has the same effect that a doxycycline does, okay? And so talk it over with your doctor, see if they think that's right for you to try, but that's an alternative to the doxycycline. In terms of so clarithromycin or azithromycin can be helpful with Bartonella. Usually so if you're very reactive, I would only start with one thing at a time, all right? That's an option. The other option would be to go herbal. And the thing that's nice about going herbal is you can start low and slow. All right. So an herb that I like using, there's a variety of things you can do that would be a good solo herb. My favorite these days actually is something called cryptolepis, which can treat Lyme, Bartonella, and Babesia. It's very useful at treating growing and hibernating or persisting Bartonella as well too. For Bartonella, for Babesia, I usually like to dose it at a teaspoon 3 times a day. But for Bartonella, I don't dose that high. I will try to work people up to a half a teaspoon 3 times a day. Given how reactive you are, where I would start is at 1 drop a day. If you don't react on that, go up to 1 drop twice a day. If you don't react on that, go up to 1 drop 3 times a day. And then gradually, as you can, keep increasing that dose, okay? The other thing, when people are super sensitive like this, if it is sensitive, I mean, again, it could be just if you're having either bad herxing or you have a sensitivity just to doxycycline. But if you find, even as you go with cryptolepis, that 1 drop bothers you, that means you're sensitive, okay? And sensitivity has a couple things with it, but one thing you want to do as sensitive people is go low and slow, like I just said. You want to do something to block your cytokines down. So that would be on a curcumin, 500 milligrams 3 times a day. Often people with reactivity like this also can have mast cell activation. So the quercetin that I mentioned just a few minutes ago, 250 to 500 milligrams 2 or 3 times a day on that. Okay, those are some ideas. We're running low on time here. I'm going to actually show you the article that I just published earlier this week on how to deal with sensitivity. Okay. All right. Let's see here. All right. So earlier this week, I released this article called Action Guide, Medicine, Hyperreactivity, and Sensitivity. Okay. So you may be this person, it's hard to tell, but if you just come off the doxycycline and even on low doses of herbal antibiotics, you're reacting easily, you may fall in this camp. And so take a look at this article and kind of give you steps to take to help get into your treatment. Okay. All right, everyone. That's it for me for tonight. It had been great being with you here. I'm sorry I had to cancel last week. I was visiting Dad in Colorado Springs, and I could not work out getting good reception for our quiet space and receptions for doing my webinar last week. I am with you again next week on Thursday, and so I hope you'll sign up for that webinar when you get my email tomorrow morning. Also, in that email will be a summary of what we talked about tonight and information on how to see the recording. So there you go. You guys had some great questions tonight. I hope you got some useful information here too. All right. Good night, everyone.